Okay, I see it's the top of the hour. There are people still joining. However, we'll get started with the introductions. So welcome everyone to today's discussion in the University of Cape Town's Division of Environmental Health Chemicals Network. And our discussion today is going to be looking at mercury and skin lightening products. What are the risks, the challenges, perceptions, and solutions? And we're very fortunate to have three presenters. I'm Professor Andrea Rother. I'm head of the Environmental Health Division here in Cape Town. This network is our community of practice that is supported by kind funding from Sweden through the Swedish Chemicals Agency, ChemE. In the background, there will be support from Dr. Natasha Lalou and Caitlin Gould. They will all be supporting you. If you need any technical assistance, please do go to the WhatsApp group. The link will be put in the chat. So our community of practice is meant to bring together representatives from different regions and sectors and stakeholder groups, which you can see being represented on the poll on the screen. And please do click on mentimeter.com if you would like to respond to it. The idea with this community of practice is to foster a mutually supporting consortium of stakeholders on issues related to chemicals. And as I mentioned today, we'll be looking at mercury and skin lightening products. And the idea is to build the capacity of regulators, researchers, and NGOs, particularly in low and middle income countries, and to discuss emerging issues. We hope to achieve this by learning from each other and sharing information, data, identifying gaps, solving problems collectively, really with the view to reduce and prevent chemical poisonings and environmental contamination with the hope of a toxic-free future for the next generation. If you're new to the network and the discussion forum, please take note that this is not a webinar and you will notice that you will not be able to speak. The only people who will be speaking today is myself as the facilitator of the discussion and the three presenters we have. If you would like to contribute, and in fact, we are encouraging you to contribute very much, this will be done through the chat. We will also have the Q&A. If you have a specific question for one of the panelists, we ask that you put it in the Q&A. If you want to ask general questions of each other or respond to certain questions that we pose to you, you can put that in the chat. We will have three presenters, as I mentioned, and we will have then a question after each with some polls, and then we will go on to the next presenter who will give background to the information. So let's move on to our presenters for today. We have two from Zero Mercury. I will ask them to introduce themselves when they come on. So we have Elena and Michael from the NGO Zero Mercury working group, and then we have Ntseke, who I will also ask to introduce himself, who's with the Department of Environmental Health in Lesotho, but also a very proud, we're very proud that he's a graduate of the Masters of Public Health in the Environmental Health track here at UCT. So welcome to all the presenters, and thank you for taking the time for this important discussion. And I'm going to invite Elena to come on. Elena, you're welcome to introduce yourself, and thank you again for taking time to be with us.
Thank you very much, Andrea. Thank you for the invitation. So my name is Elena Lymberidi-Settimo. I work for the European Environmental Bureau, which is the largest NGO network in Europe. But together with Michael, we are also the international co-coordinators of the Zero Mercury Working Group. We are also co-leading with Michael and the US EPA. We are co-leading the Global Mercury Partnership and the product area under this. Next slide, please. So two words about the Zero Mercury Working Group. It's an international coalition which was launched in 2005. It now has more than 110 public interest NGOs from over 55 countries. And we have been working for 20 years and more, aiming to address mercury pollution and exposure, and of course now implementing the Minamata Convention. Also, under the Zero Mercury Working Group, we have launched the Skin Lightening Cream campaign, and we have been working with many partners, so we'd like to take the opportunity to thank them, and you can see the ones who were involved in the last sampling exercise that we carried out last year. Next slide, please. So I would like to introduce a few elements. It's to kick off the discussion. As many of you know, skin lightening products are used all over the world, and they are a symbol of societies grappling with internalized racism and colorism, skin color-based form of discrimination, typically occurring within a given community or group, which favors lighter over darker skin color. However, mercury, which is used in creams, it's a bleaching agent. The most common ingredient is the ammoniated mercury, and mercury is inhibiting the formation of melanin to produce the whitening and anti-freckle effect, and that's why it's being added frequently in these creams. However, mercury-added skin lightening creams present significant health risks, and prolonged mercury exposure can result in serious health problems ranging from dermatological to neurological. Mercury can be absorbed through the skin and the lungs, and can lead to rashes and can also damage intestines and kidneys. And also long-term exposure can damage eyes, lungs, the digestive, immune, and even nervous systems. As you can see, also the mercury exposure, it's not only to ones who are using it, but can affect others living in a home, and it can even lead to homes needing to be decontaminated. WHO warns on the health risks of certain skin lighteners and recommends their phase out. And due to this problem, the Minamata Convention Mercury, which was adopted in 2013 and entered into force in 2017, bans the manufacture and trade of cosmetics of over 1 ppm of mercury by 2020, and all of the cosmetics containing mercury by 2025. Next slide, please. And here you can see the effects from skin lightening creams. As we say, pictures speak more than words. You can see that the use of these creams can cause hyperpigmentation, excess acne, redness, itches, and even blotching. Next slide, please. So since 2017, the Zero Mercury started its Mercury-added skin lightening cream campaign. Since then, we have tested over 1,000 products, initially focusing on the markets on the ground, but then in the recent years, we've been focusing on products which have been purchased from online platforms. We have published 5 reports. The last one was last year in 2023. And these creams, as you can see, they have been collected from around the world. A very high number of them has been found with very high mercury, and in many, many cases with thousands of ppm above the allowed limit. So several of the products have been tested from many different platforms, different regions, and in different years, but they continue to be found with high mercury. All of these products that we have tested can be found on the Zero Mercury online database. And furthermore, in our database, we include lists of products which are part of government prohibited lists or detention lists, as we call them, such as Uganda, Kenya, or Brunei. So the last report was from last year in October. And also, if you visit our website, you can see executive summaries in French and also in Spanish. Next slide, please. Here you can see a few of the e-commerce platforms where we found the high mercury products. So for Africa, since I think most of our colleagues on the call are from Africa, you can see platforms like Gigi, accessible from Kenya, Nigeria, Uganda, but also Zumia, Kilimanjaro, Konga, Bird or Buy from South Africa. And then many of these platforms are also from Asia, Lazada, Shopee, etc. And also at the bottom, some samples of creams where we find very high mercury: Pfizer, Nizagol, Gori, Parley, Chutney, Papaya. Next slide, please. To complement our work, apart from the sampling, we have launched a couple of dermatological surveys. So here you can see the results from 2 of them, Bangladesh and Pakistan, where already we can see that patients in many cases are not aware of the toxic substances in skin lightening creams. Over 60% of the dermatologists surveyed were presented with facial skin problems, and also many of those, most of them were due to skin lightening creams. And also you can see that most of the users from these studies can be seen as women in age, young or average age. Next, please. Furthermore, the Zero Mercury has been supporting another investigation which was carried out by the Environmental Investigation Agency. Also, this report was published last year. And this study revealed that there is a standard practice for manufacturers to be adding mercury compounds, and mainly ammoniated mercury, in their products. So this is still happening. They identified as centers of production Thailand, Jamaica, and Pakistan. However, they also identified that intermediate transit ports were in the EU, the United Arab Emirates, and in the US, showing again the globality of the problem and how difficult it is to control. And also the fact that compounds need to be restricted as they create currently a loophole. Next slide, please. So overall, the challenges that we have been observing is that obviously the toxic online trade continues of these creams. The countries of origin that we have been observing, mainly from the packaging of these products, is Pakistan, Thailand, and China, but of course others. Sometimes the packaging can be quite misleading, so indicating that there's no mercury, but in this particular cream, for example, mercury has been found in 6 different occasions. And also, it's not only a mercury, but mercury compounds which are concerned. Next slide. So the skin lightening products, this use is often perpetuated by media campaigns, which have shown to be successful in steering consumers to lightening, whitening, brightening, or fairness products. And also all this work has, on the other side, has led to some increased awareness on the scope of the issue, and also growing attention from media. So for example, a couple of years ago, CNN launched its White Light series. Also one of our reports was presented for the first time through this series, and many other articles have followed. Also, more projects and initiatives have started also at global level. So we have GEF, Global Environment Facility project supported by UNEP, WHO, and the Biodiversity Research Institute, which is focusing exactly on elimination of mercury-added products, of skin lightening products. And the work is carried out actually in Sri Lanka, Jamaica, and Gabon. And we can go to the next slide. And also the Global Mercury Partnership, also by having started by this project, is also has created a knowledge hub. So you can visit this website where you can find most relevant information on skin lightening products, but also they have created a community of practice, it's a Google group, which you can also join by contacting our colleagues from the Secretariat. Also through these projects, and which will become available, the intention is to have a global database of these high mercury products. And so the interest and concern is growing, and this has also been shown, as Michael will discuss later on, in the recent Conference of the Parties under the Minamata Convention. And I think I'm going to stop here. Next slide, please. And I want to thank you for your attention. And this is to just give some background of the issue. Thank you very much.
Thank you, Elena. That was very succinct, and you presented a lot of the issues and information and what's being done and available. So thank you very much for that. I'm now going to encourage everyone to go into the chat. We have a question for you. So what are the concerns or issues with mercury-added skin lightening products in your country, or perhaps the organization that you work for? And you can include your country and organization in your response. Elena, I'll ask you to stay on. You can keep your video on and stay unmuted, because what you can do is look at what's coming into the chat, and you're welcome then to just verbally respond. Also, just a reminder, if anyone has any questions, to please post them in the Q&A, and we will then proceed. And just see, there's some messages coming through. Perhaps I can ask you a question while we're waiting, and that is with the Global Mercury Partnership, if you had to give one or two things that they've been effective with, you know, what has been like the one or two real benefits of the Global Mercury Partnership? What would you say they are?
The partnership, I mean, now as it stands, it's a good platform to bring all the different players together. So industry is invited to join, also NGOs, governments, of course. And now through this work, as I presented in the before last slide, this platform, this community of knowledge can bring these people together, and also can allow for exchanging of information. And also can allow for people to know what is out there. Also, the database that is already available can be used even for people who go and purchase such creams. Although, of course, the best would be not to be purchasing those at all, because as we say, you know, black is beautiful, the natural color of the skin is beautiful. But then the information that is out there through the partnership and through these platforms can also help people protect themselves to one extent. And also we hope that this will be used also by governments to start forming these prohibited lists for their countries as a detention list, as a way of controlling also the products that come in. So it can have the information, I think, and exchange of the information, the scientific information, but also the fact of who is working on what is very useful for the partner, for the people, and through the partnership to get that and allow for this and make the issue also more known and people to communicate their challenges.
Thank you for that. We have a question from Rico from Groundwork. I don't know if you can see it. What practical steps can regulatory agencies, for example, Minamata Focal Points and National Departments of Health, take to address illegal sales of skin lightening creams on online platforms?
Yeah, thank you, Rico. I think this question will be for Michael. Afterwards, Michael will be touching on this. We have been discussing this, obviously, and with Rico for many years. So it's important that the governments really check the responsibilities that they have. So that there are different responsibilities within different departments. So it's important that the different agencies and government players are aware. They communicate with each other, and then obviously training will be needed for the customs, for the police. So because we are also looking at on-the-ground borders and on online borders, and so there are several things that will need to be done. I mean, there is a whole list of things, but I wouldn't want to go on that because I think this is Michael's presentation coming up. So a little bit of patience, I think, and things will be discussed in there.
Thanks, and we can always come back to that. Rico can always post again. Just to say, for those of you who may be joined a bit late, that we don't take any hands for participants who want to speak. If you can please put your comments in the chat, or if you have specific questions, if you put them in the Q&A, we'll make sure that they get answered. There are quite a few comments coming through. So Elena, I don't know if you want to comment on some of those. Also, just a reminder, there's a link to Mentimeter in the chat if you want to answer the poll on the screen.
One more thing that I can see here some questions coming in from Iran. This is very interesting. So again, it will be Michael is going to talk about this, but I think the repetition here is quite for our benefit. So there is the Minamata Secretariat has asked for information on the challenges and the measures that are being taken by parties on skin lightening products. So I see here the question or comment from Iran. I think it will be important to communicate the findings that you have from your countries and to the Secretariat, and also underline the challenges that you face, and also what is the most important challenge, or what would you think that the Secretariat and the global community could do about this. So this is just a quick reaction to that. The deadline for this is the 30th of June, so it's really coming up, and it's highly relevant to this discussion.
There's quite a few comments, I think, about illegal
Yes,
imports and smuggling.
Yeah, I see that. But we will discuss this afterwards. Also, awareness. I see. Yeah, coordination. As I said, that's important. Also, awareness to the, for example, young women in the universities, or some targeted awareness raising will be key. And the awareness raising also, it's not only on the public, but it's also to the government agents, as I said before, because people will need to know about this issue, and maybe they just don't have it in the radar, like the police, the customs, or if there are special enforcement agencies who will just go on the ground and check, for example, what the pharmacies are selling. And also, let's say, complementing legislation like about related to advertisement, related to digital services. These are things that will be touched upon in the next presentation as well.
So I see that 3 people have indicated in the poll that they know of someone or have themselves experienced adverse health effects. It would be nice if you could put the example, if you're willing to share, in the chat. Again, there's quite a few comments coming through from different countries, from South Africa, Gabon, Philippines, Lesotho. I suggest we go on to the next poll. So the next question is whether your country actually has a national register for mercury poisonings from skin lightening products. I know in South Africa, it's a medical notifiable condition if there's a mercury poisoning. Sorry, Elena, please go ahead.
No, I'm just reading the comments and just reacting to that. So also just to know overall that Senegal, Togo, and Burkina Faso, they are currently carrying out a project on mercury-added products. So they are developing their strategies on how to phase out these mercury-added products. And of course, the cosmetics will be part of it. So this is just to provide some information here to our colleagues. Maimuna, some of our colleagues I recognize, so good to have you on the call. Also, in the WHO project, Gabon, Sri Lanka, and Jamaica are the 3 countries where work will be carried out on skin lightening creams, but then some elements will be, of course, for global use, and the countries neighboring to those countries will also be benefiting from those. Yeah, it will be great if we had indeed more information through the chat related to the answers in the polls. That would be very interesting. And again, I would encourage you to put all this relevant information to the information requested by the Minamata Convention Secretariat. All of this will be highly relevant.
There's also a comment that's been posted in the Q&A from Nico, saying that Namibia does not have any issues or concerns on skin lightening products, and it would be good to know why not. Is there strict regulation, or is it just a lack of awareness of whether it's a problem or not?
I would be surprised if Namibia doesn't have any problem. I mean, we haven't really looked at the country specifically, but I mean, having seen where these products go, I would be really surprised that there are no issues. But I don't know if the colleague is from government or, yeah, so that would be interesting.
Nico, perhaps you could explain your comment in the chat. That would be great. And also for the 6 of you who've said that you have a national register on mercury poisonings, would be great if you could just say which country. And we still are focusing on question 1. Should you have any comments? So that was about the issues and the concerns with mercury in your country.
So, I mean, in terms of the trade, yeah, I mean, this will be touched upon. We have been carrying out, also colleagues who are on the call, they have done actually this work in different parts of the world where they have been trying to sort of investigate how these products are coming in. And this is, it is indeed very tricky. So there are different ways of addressing on trying to make the space of illegal activity as small as possible. So of course, this could be with regulatory measures, but then it can also be with some voluntary measures that will be discussed afterwards. And there will be a need for top-down and bottom-up measures, as I've been saying, because yeah, unfortunately, it's such a big space. I mean, we have been looking in the big platforms, as I mentioned, Amazon, eBay, and the others around the world. But we have indication also from colleagues that people, they take a cream and then add mercury and then mix it and then sell it through a Facebook channel. So there, of course, the multiplication of the availability of such dangerous products, it's enormous. So this, of course, we just need to squeeze this space of illegal activity to reduce the exposure as much as possible, and that's why this global effort is needed, and from all dimensions. So not only from government side, the manufacturing, of course, is very important. That this is what needs to stop, and then everything else to be going the same direction.
So as we wind up this question, I see no one seems to be coming forward in terms of saying who has a register, but several countries are coming forward saying that they don't have a register. South Africa, as Flavio stated, is a notifiable medical condition, which is then investigated by the environmental health practitioners, and then there's a surveillance system. So it's an indirect register by having it as a medical notifiable condition. And then there's one in Senegal as well. So do you have any last comments you'd like to make, Elena, before we move on to the next presenter?
I think I'm okay for now. As I said, it's better to let the presentation flow, and then we can pick up the trade discussion, I think, and the measures discussion next.
Perfect. Well, then thank you very much, and thank you for setting the stage for the discussion. And we will move on then to our second presenter, Ntseke, who is, as I mentioned, from the Department of Environmental Health in Lesotho. and also was a Masters of Public Health student here at the University of Cape Town in the Environmental Health track. And he is going to present today his case study and the findings from his research that he did for his master's thesis. Ntseke, you're most welcome, and I hand over to you to introduce yourself if you would like to say anything else, and we look forward to your presentation. Thank you.
Okay, thank you, Prof. Please confirm if I'm audible.
You are audible. It's a little bit rough, and maybe we can just make it a bit louder, but let's try again. I think if you say something.
How is it now?
It's okay. It's a little bit fragmented, but I'll interrupt if it's difficult to understand. So go ahead.
So yeah, I just realized that because in the middle of the discussion, I just said that my speaker is a little bit moving up and down. So I wasn't sure if the mic got.
Yeah, it's not very
So-
clear. I don't know if you want to unplug your headphones and maybe just speak without the headphones. Sometimes that's a bit better.
Let me take it out.
If you say something, let's see. You've muted yourself, but if you can say something, that would be great.
Can you hear me now?
It's a little bit better. Now we have the echo.
Come again, please.
Please proceed. We have an echo now.
Oh. Okay, good day everyone. My name is Ntseke. I work for the government of Lesotho in the Ministry of Health, specifically under Department of Environmental Health. Yes, I graduated from UCT last December with a PhD, and special thanks to Prof. Andre for being one of my former course convener for several modules and being supervisor for my thesis. And today I'm happy to share with you part of my findings from our case study on the assessment of assortment perceptions of the health risk linked to skin-lightening products in Lesotho.
I'm just going to ask Natasha if we can put a transcript on so that people can read, because unfortunately we cannot. It is a bit broken and hard to hear you, Ntseke. So I don't know, Natasha, if there's a transcriber that you could put on so people can read what he's saying at the same time. Thank you.
I don't think that's it here. We've got captions enabled, but it doesn't seem to work live.
Yes.
Ntseke, is there perhaps a speaker that you can turn off, because I think an echo is causing a problem as well. When we did the mic check, it worked fine.
Maybe with plugging in the headphones again might be better. Our apologies for this. Ntseke, you're muted.
I was suggesting maybe you can proceed to the next presenter while I change the device that I'm using.
Okay.
See if maybe better.
Okay, thank you. Thanks for that. And I apologize that we're having issues. If you just mute yourself, and then Michael, are you okay if we move on to you?
Certainly.
So Michael is also from Zero Mercury, and thank you very much, Michael, for taking of your time to take us through what is the third question, but I'll let you go ahead and introduce yourself. Thank you.
Thank you, and thanks to UCT for this opportunity. And hello, everyone. My name is Michael Bender. I'm the director of the Mercury Policy Project here in the U.S., and I also co-lead with Elena the Zero Mercury Working Group, and also am the co-lead of the UNEP Global Mercury Partnership product area. So today I'm going to be talking about strengthening the enforcement of mercury-added skin lightening product bans, and that's both regarding the manufacturer and also the export and import that is already in the Minamata Convention, and many national governments, including many governments in Africa, do have regulations in place. Some have enforcement, and as we say, it's not enough to have the legislation and the regulations. It's really those are the key steps to put you in a position to actually enforce keeping these products out of your country, coming into your country, and that's what we're going to be talking about today, along with the opportunity to provide comments to the Minamata Convention Secretariat by the end of this month. Very important, if it's possible for you to do that. And we've actually circulated, the Zero Mercury Working Group has circulated draft comments for you review and possible use. And I don't know exactly where those are accessible, but I'm sure we will know. So next slide, please. So as I said, the Minamata Convention currently bans the manufacturing trade of skin lighteners with over 1 part per million mercury compounds, although addressing the purpose, the mission of the convention are not currently regulated. Last year, the African region proposed an amendment to COP5, which is the 5th Conference of the Parties. And they had several areas that were recognized as challenging beyond just banning the manufacture and trade, and those include addressing national sales and advertising bans and offering of sales. However, that wasn't the direction the Conference of the Parties decided to go. Instead, they reached a compromise to ban all mercury-added cosmetics by 2025, and we think this is a very extremely helpful step, because this will allow particularly countries and civil society and academia in the global south and also elsewhere to be able to use handheld devices and not have to rely on the training and expense of sending suspect skin lightening products to the lab. So the directive to the Minamata Secretariat was to conduct a study of the global supply, production, trade, and use of mercury compounds, which are mainly what's added to these products to foster an inexpensive way to lighten the skin, although very toxic. As I mentioned, the Minamata Secretariat is soliciting input by June 30th on the challenges of banning mercury, banning manufacture and trade, and based on the input received, there will be a draft report for the Minamata Convention Conference of the Parties, sixth Conference of the Parties, scheduled for Geneva in November of 2025. Next slide, please. So when we look at methods for illegal trading of mercury-added skin lightening products and compounds, there are a number of different ways that that these products are being illegally or legally transferred. In the case of mercury compounds, we don't yet have the global regulations we need. We're hoping they'll come as a result of the study being developed for COP6. But things like falsifying documents, falsifying labels, not having the ingredient list on the products, no shipping documents, evading tariffs or taxes by double invoicing, falsifying, disguising country of origin, hiding mercury compounds among other goods, illegal use of free trade zones, lack of required permits or licenses or other authorizations using unauthorized point of entry into a country. And last but not least, and one of the focuses of our work has been on the suspect toxic trade via the online platforms and in many cases the third-party sellers. Next slide, please. So as I mentioned, the mercury compounds are not regulated currently under the Minamata Convention, although there is a provision, an avenue available to do so, and we hope that there is support for that, because when we talk about reducing and otherwise eliminating mercury added products, we need to turn off the mercury tap, and especially for those countries that we know have manufacturing centers, we need to really work closely in support of those governments and building capacity to work with those industries to transition out of the mercury added mercury compounds. So we had a study Elena mentioned last year that we worked closely with the Environmental Investigation Agency. The report confirmed that the intentional use of 3 to 4% mercury compounds in the most prevalent mercury compound used is ammoniated mercury in the production of skin lightening products. There was a Natural Resources Defense Council study on the feasibility of conducting global inventory of mercury compound supply, use, and trade last October, just prior to the COP. That was very helpful in the COP decision to study further this mercury compound issue and for consideration at COP6. Next slide, please. So as I mentioned earlier, at the 5th Conference of Parties last year in Geneva, the African region took a leadership role in really highlighting the importance of the convention, taking on this issue and the importance of ensuring a zero tolerance for all mercury cosmetics. The WHO indicates that there's no safe level of mercury in for exposure. So we thought that was a very, very constructive development. And then they were looking at, as I mentioned earlier, banning the online sales, advertising, marketing, merchandising. And this, again, is on top of, not in lieu of, banning the export, import, and manufacture. We believe there are additional steps that are needed, especially for the challenge of online marketing, and not just with the major platforms, but also via Facebook and other online social marketing that is out there. And then very importantly, I can't emphasize enough that not only do we need interagency collaboration, but we need regional and global coordination. And we do have examples of that in the EU, in the one region in Africa, and also in Asia with ASEAN. And then we need to look at simultaneously promoting a reduction in both the demand and the supply, just like with all other mercury added product categories. Next slide, please. So just to reiterate the COP5 decision last year in Geneva by the Minamata Convention group, bans manufacture and trade all mercury added cosmetics. Input requested by the Secretary by June 30th on both the challenges in preventing manufacture and trade, and also proposed measures for addressing these challenges. Very, very important. And the Secretariat has developed a form. You can't really see it here, but they're really very interested in your input via whether you're a government or NGO or academia. And after the Secretariat gathers this information, they were requested to prepare a report for COP6 on banning offering of sales of mercury-added skin lightening products. They're very interested in hearing about any strategies for discouraging marketing, advertising, display of mercury-added skin lightening products. Also, we did a survey, or actually an outreach of a number of countries in 2019, and And we have our enforcement report, which identified many of the strategies, including the advisories, detention lists, prohibited substances lists, requirements for licensing and product ingredient approvals by the manufacturers, developing and implementing product safety pledges, which are online. We're targeted for the online platforms and very much in a voluntary capacity to complement the regulatory regime, and finally raising awareness of the hazards. Next slide, please. So in an effort to respond to the call for information from the Minamata Secretariat on the challenges of banning manufacture and trade of mercury-added skin lightening products, it's important for countries and civil society to consider where they have gaps, identify the challenges associated with those gaps, and where capacity building is necessary. If, on the other hand, the country does have measures already in place, it would be helpful to submit those to the Secretariat, as others could benefit from that expertise. And as you can see, there are a number of complementary measures that governments have taken and can take, starting with having your regulations in place, developing a legal gap analysis, which you probably have already done through your Minamata initial assessment, developing a list of the allowed and the banned ingredients, labeling requirements, complementary regulations, cutting supply and demand. As I mentioned, the advisories, the licensing and product ingredients, and then very important, the enforcement measures, and who does what, and really putting together if you will, a roadmap for addressing this, and the penalties and sanctions are also necessary as well. And then finally, we need for advice bans that are discouraging the advertising, display, and marketing. Next slide, please. And then in terms of the gaps, challenges, and response measures, do you have the needed capacity in the following areas? For data collection, to verify mercury content, as well through accredited labs. If you do, that would be helpful to share. If not, it's important to assess if this is a challenge, if such instruments are missing, they're not available in the region, and what levels of regional cooperation should be established between countries. And in terms of awareness raising, outreach that's necessary to inform consumers, but also platforms, third-party sellers, the need, importance of collaboration with academia, dermatologists, and civil society would also be highly relative. Also, it's very important that there's both interagency, interregional cooperation, as I mentioned earlier. And when we talk about interagency cooperation, it's important to identify and involve all the appropriate agencies within the country. For example, the Ministry of the Environment, the Ministry of Health, customs and their policies, and what kind of training they have or need to identify the gaps and challenges in terms of coordination, capacity building, and training. And as I mentioned earlier, the controlling the online platforms is a major challenge. The way these platforms actually started online, they were viewed more as newspapers and conveying information rather than conveying products. And as we all know, they are very much in the business of conveying toxic trade and products that really should be unacceptable. But the challenge is for countries and regions is how to regulate. And as I mentioned earlier, one of the areas that a number of countries in Europe and now spreading across the globe, and 4 or 5 other countries, including India, is now considering is this voluntary product safety pledges, where the online platforms step up and work collaboratively with the governments. And that will be an area of challenge after all the other mercury-added products in Article 4 are eliminated. Governments, academia, civil society, dermatologists, health ministries, we're all going to be continuing to face this challenge. Next slide, please. So in conclusion, and a few recommendations, illegal mercury-added skin lightening products are a global mercury crisis. warning concerted international action, and that includes action on both limiting and banning the trade, banning the manufacture, addressing the advertising and the sales. Along with that, effective enforcement is really critical to ensure that these regulations are being upheld. That online platform liability reform is needed so that these platforms can't operate with immunity and these third-party sellers are held accountable, and that we really can't emphasize enough the collaboration between government agencies is key, the coordination domestically, and that also internationally, regional cooperation, especially, in terms of limiting exports and imports. And without globally coordinated effort, protection and trade of these mercury-added toxic skin lightening creams will persist into the foreseeable future. Finally, we really encourage you to consider submitting comments to the Minamata Secretariat. As I mentioned earlier, Zero Mercury has put together in-depth draft comments for your consideration and use, and I believe that they are accessible or available through this forum, and maybe one of my colleagues can elaborate on that after my presentation. And then just the final slide, please. Thank you for your time and your attention. And as I mentioned earlier, a lot of this work came through research of our many Zero Mercury Working Group partners all over the world in developing this 2019 report on enforcement measures that we've derived and updated a number of our draft comments to the Secretariat, and we encourage you to take a look at that document, and if you need further references, to go back to this enforcement document, which we have the link available, and then more generally for all of our reports, they're available online on our campaign websites. Thank you very much, and I look forward to any questions.
Thank you very much, Michael. It's always important to know how one can start to address the challenges. And I think your sort of plea and request for information to help support the Minamata Convention, and also because we have people from all over low and middle income countries on this community of practice, it's important to encourage people to go ahead and submit. Could we have the next slide, please? We are moving into the third question at the moment, and we will then go back. We'll go back to Ntseke's presentation. So how is your country planning or working on overcoming challenges of banning mercury-added skin lightening products? And if you can include your country in it. Just a reminder, if you have a Q&A question, if you have a question, please post it under Q&A. It's easier for us to find it than in the chat. And also for some of you, just a reminder when you are responding in the chat to make sure it's to everyone and not to just the hosts and the panelists, so that everyone can see your comments. While you were presenting, Michael, and while people are posting comments to this question on the screen, I started thinking about the companies that are making these products that have mercury in them. Are they shifting to other hazardous chemicals? Is there a need to broaden the awareness of the dangers in general with skin lightening creams? Is it just going to go away with mercury being removed from the products? What are your thoughts on that?
Right, and a very good question. So thank you for that, Andrea. Mercury is one of a number of really problematic ingredients that are oftentimes added to these products, makes them inexpensive and therefore attractive for low-income folks. Things like hydroquinone and lead and just a whole myriad of toxic and hazardous ingredients. And I think that's one of the reasons why We are really of the opinion of using no skin lightening products, that we really encourage people to really support that approach and to not look for lesser or non-toxic products. Obviously, we want to discourage consumers from using any products with mercury, which is really very, as Elena's slides, the one picture shows, can be very severe and is very detrimental not only to the user but also to the members of the household, because mercury can migrate very easily in a person's home. If for instance a user had the cream on their fingers and they touched their countertops or they touched their laundry, then their laundry will get contaminated. We found instances, there's examples in the United States where the cleanup of someone's home who's used these products is very expensive, and as I mentioned earlier, there's documentation, especially for pregnant women and children, that are highly susceptible to mercury's impacts. So I did want to put in a plug that Elena had posted in the chat, that the decisions and the opportunities for comments, the form from the Minamata Secretary, I believe it's up there. And Andrea, I just wanted to ask you, is there a link to our draft comments that you can point people to so that they can utilize those, or are they up there already?
I think Natasha has posted them. She can confirm, but I think Natasha has posted them in the chat.
Yes, I have, but I will post it again in case it's gotten lost.
Thank you.
Yeah, and Elena's also posted a link to CNN White Lies series, which people may like to look at. And there are also some other reports coming through. It made me also think when you were talking about the fact that, the skin lightening products are hazardous in themselves, not just with the mercury, that this whole aspect of what you raised about advertising and marketing and addressing advertising and marketing, it made me think of Elena's pictures that she posted, and how, tobacco products in many countries now have to have these pictures on them of the health effects that will happen to you if you smoke. It would be interesting if there was a law requiring that you had to have photographs of the potential damage to your skin. It would be a bit, on the one side looking light, and on the other side all the possible damage that it could have. Natasha, could we have the next poll, please? So there are comments in the chat. I don't know if you'd like to look at those, Michael. In the meantime, people can click on the link in the Menti link in the chat if you'd like to indicate what some of the opportunities or national measures that the Minamata Convention could support. So within your country, what kind of support would you need for reducing and eliminating mercury-added cosmetics?
Yes, and on that point, I can provide some examples where there have been different projects under the convention to support customs training, and also to support the purchasing of XRFs, which are handheld mercury detection. Actually, they're broader than just for mercury. They're heavy metal detecting devices that can be purchased for perhaps $2 to $3 USD, $2 to $3,000, and they're very necessary for customs to have that screening ability, and also for health ministries and local governments to have these handheld testing devices in the U.S. There's some colleagues in the state of Minnesota that walk through markets with the Lumex. Others can walk through with the XRF, because again, under the new convention requirements and amendment, that all we need to do is determine which products have mercury added to them and which don't. And because the mercury vaporizes, it's something that's very detectable through these handheld devices. Thank you.
Thanks. I don't know if you want to comment on what you see on the poll. At the moment, we're still waiting to see what other countries need in terms of support. You can include your country. That's always helpful.
Well, as I was saying earlier, there's sort of a series of steps that countries should consider, starting with, first of all, do you have a law in place which prohibits and bans mercury added products, including skin lightening products? And then once that law is in place, do you have the regulations to support such a law? And that's where it gets into some challenges about interagency cooperation. Is there a lead agency that's taking this on, and then are they convening some kind of a working group or development of of some kind of a Mercury roadmap? In most countries that are parties to the convention, they have Mercury focal points, and that could be a good first place to check in with in your country, is with your focal point, to determine what, if any, capacity building needs have been identified, whether it's for purchasing an XRF, training customs, developing regulations, conducting a legal gap analysis, those kind of things. I think that would be very helpful for the Secretariat to hear what your capacity building needs are. Thank you.
Thanks. So there have been some comments that have posted, but in the interest of time, if we could just have the last poll, and then we will need to move back to see if we can get Ntseke to speak. Is there support in your country for a national sales and advertising ban of these products? Again, if you just click on the link in the chat, you can indicate, and we have some responses coming through already. Thank you.
Yeah, one of the reasons why we've raised this issue, and we were very happy the African region proposed this amendment, although it did not get adopted at the Conference of the Parties, is because in many cases, countries already have these bans on manufacture and trade. And these products, as we've demonstrated, as you saw in Elena's presentation, over and over, we're seeing these products marketed. A lot of times these products are marketed internationally. Some of these manufacturers we've learned have over $1 million advertising budgets to really push these products on the public. And then we have these online platforms that are financially, and these third-party sellers that are financially benefiting from the illegal toxic trade in these products. And they need to be challenged, and we've been challenging them, and we've been in conversations with many of the online platforms to remove products that we've identified as having mercury in them. And many of these online platforms have been responsive, especially when the news media calls them, but then in a couple of months we go back and we see these products are being offered again, or the label has slightly changed to avoid whatever the ban was on a listed product, that are listed through the detention list. So they're about a challenge in that area.
Thank you. Thanks, Michael, for that. Yeah, I think when we talk about chemicals risk management in general, the online platform is a big challenge, whether it's mercury containing creams or pesticides or other products. So it really is it's a big challenge. I encourage the three of you who've indicated that you have a national sales and advertising ban. If you could just indicate in the chat your country, that would be great. And Michael, thank you very much for your input. You can come back later on if we've got time for any other questions or comments. But thank you again. I think it's really important what you've presented, and particularly encouraging people to really use a bit more of the Minamata tool, the convention, by providing information. And Ntseke, let's try and see now if we can go back to your session. So if you can say something.
Yes, can you hear me?
Perfectly. Thank you very much. So welcome again. And just, I thought I'd also just give a shout out. I appreciate the thank you for being your supervisor on this project that you're going to talk about, but also to Rico Euripido, who's also on the call, who was a co-supervisor. Over to you to let us know a bit more about what you found in Lesotho.
Okay, thank you very much, Prof. Andre. My name is Ntseke Makutoane. I work for the government of Lesotho in the Ministry of Health, specifically under Environmental Health Department. I am happy to share with you part of my findings from our case study on the assessment of assortment perceptions or the health risk linked to skin lightening products in Lesotho. Next slide, please. Our case study was basically a mixed methods cross-sectional survey where the main target population were women 18 years and above, and key informants from different governmental ministries and a local university. 100 women were sampled using a convenience non-probability sampling at two healthcare facilities in Makutoane district for interviewing, while 5 key informants were recruited via purposive and snowball sampling. Next slide, please. The first objective of the study was to document Lesotho women attitude, perceptions, and knowledge of the health risk of using skin lightening products, going along with identifying interventions that could address those perceptions and motivations to reduce health consequences associated with using skin lightening products. The last objective was to explore the perceived barriers to the availability and implementation of regulatory action and national legislation that regulates skin lightening products in Lesotho. Next slide, please. Rushing to the findings. Slightly above 50% of the women participants claim using or have used skin lightening products, and 75% of those were married women. Also, almost half of the participants had described themselves as light brown skin complexion, whereas only 13% described themselves with black skin complexions. Of the 52 participating women who used skin lightening products, 54% had secondary school level as their highest education level. Again, when those who use skin lightening products were asked where do they apply skin lightening creams on their body, close to 80% reported that they apply them to their faces. Next, please. There were several motives for using skin lightening products from the responses we get from the participating women. But the top 3 motives were to have a lighter skin complexion, also to be used as a remedy to remove black spots and pimples on their faces, and also to look beautiful. Other motives included to have a softer skin, to impress peer, to remove oil on the skin, to look attractive in the eyes of male companions, and so on and so forth. Findings reveal that married women dominated in all 3 top motives for using skin lightening products. That is by 69% in the first top motif, 79 in the second, and 62 in the third. This shows how desperate women needed to maintain their beautiness and have spotless faces, regardless whether they are married or they are not married. Next, please. So most common places for buying skin lightening products were revealed as street vendors, supermarkets, and pharmacies. And this is in line with the findings that 60% of the women who use skin lightening products claimed that they spent less than US dollars 3.16 monthly to buy skin lightening. As we know, items we get in the street are very, very cheap too, so it becomes easy for them to access them. Next, please. Also, the perception that lighter skin tone provides women with higher self-esteem, and the perception that men consider women with lighter skin tone more beautiful, had almost equal scores. That is 58% versus 55%. And besides that, 57% of the participating married women believed men consider women with lighter skin tones more beautiful, whereas only 40% of the participating single women believe that. Surprisingly, 69% participants disagreed with the notion that lighter skin is more attractive. And also 63% disagreed that having lighter skin tone increases women's likelihood of getting married. This was regardless of whether they use skin lightening products or not. Next, please. Almost 1/3 of the married women in the study believe that a lighter skin tone enhances men's chances of getting married. Interestingly, 42% of the women who did not use skin lightening products believe that men would consider light-skinned women to be more beautiful, and 46% believed lighter skin provides women with higher self-esteem. Next, please. Also, when they were asked what circumstances could encourage them to use skin lightening products, top 3 circumstances were skin tone discrimination, to recover from the damage from overusage of skin lighteners on their bodies, and also lack of regulations on skin lightening products. Other circumstances including being poor, post-sickness that darkened or damaged their skin, peer pressure, and a feeling of being unloved by companions due to dark skin complexion. Next slide, please. So about percent of the participants claim to have heard, read, or seen something maybe in the media on skin lightening products usage and their consequences. Yet, surprisingly, over half were using or had used skin lightening products. However, there was no statistical significance in the relationship between participating women who used skin lightening products and knowing about skin lightening and its consequences. About 30% of the 52 women who reported using skin lightening products also reported they never had seen or heard about skin lightening health consequences. Importantly, 90% believe there are negative health effects from using skin lightening products. 77% felt those negative health effects could be serious or fatal. Next slide, please. These are the examples of the skin lightening creams that are freely available for sale in the street, market, and shops in Lesotho. And some of them were analyzed by NAL, National University of Lesotho, on behalf of the Department of Department of Environment in one study, and found to contain mercury levels, and some of them were found to have mercury levels that were above limits of the Minamata Convention on mercury. Next, please. So there's a need for the government of Lesotho to empower its public healthcare facilities to provide specialized skincare services which are affordable to all, so that people will stop opting for skin lightening products when maybe they have some skin problems. So the adverse health effects of skin lightening should be addressed starting at the most basic level of education in schools, and public health campaigns be targeted at consumers to discourage the use of skin lightening products. Lesotho is a party to Minamata Convention. All now that is needed is to domesticate the convention and strongly enforce it against the sale of skin lightening products with harmful chemicals like mercury. It is also equally important for Lesotho to strengthen its borders against the importation of skin lightening products into the country. Next, please. So from the study, there's evidence that women are aware of the substantial health risk of using skin lightening products and do understand their serious implications, but they are willing to compromise their health as they believe there are more social gains from the perceived benefits compared to the perceived susceptibility of or severity of unhealthy practice. So skin lightening motives, influences, and circumstances seems to overweigh their desired good health behavior. And that's why awareness is more important, and it has to be repetitive so that people will often hear that skin lightening products are very dangerous to their health and also their children and people they are living with. I think this is the last slide. Thank you for listening. I'll be here for the question. Thank you.
Thanks very much, Ntseke. And I know it's always a challenge to do that kind of research and collect data. So thank you for sharing it with this community. If there are any questions for Ntseke specifically, you can post them in the Q&A. I think there was a question from Bruce. Are there some health implications that women mentioned are associated with the use of the lightening products? Ntseke, do you want to respond to that?
Yes, Prof. One of the questions that were directed to the participant was whether they knew of any health risk of using skin lightening products. Yes, some of them mentioned that they are aware of those, and they mentioned them that they include maybe their skin thickening, their skin becoming dark, having some pimples on their faces after using products. And some even mentioned that the
they are now afraid to stop using them because they have realized that some of the people who are using them, once they stop using them, that's where they are seeing more of the health effects on their skin. So most of them are aware of the health risk that comes if using skin lightening products or creams. Yes.
Thanks for that. There's just some comments. I don't know if you want to comment on anything. So Sheridith talks about in Guyana with the skin lightening products used by people want to see their color, the skin of their color less dark. They're motivated to do this based on trends, style, fashion, and under the impression they'll be better accepted by society. I mean, I think your finding about people thinking that they will have better chances with lighter skin of getting married is sort of feeds into what Sheridith said. I don't know if you have any comments on that.
Yes, looking at the comments in the chat, I would much agree with the comments that I'm seeing, that skin lightening may be influenced, for example, by fashion, because we know there are some of the celebs that will be using skin lightening products and encouraging people to using them. So if people see the people that they are role models, they start using them unaware sometimes that it can be very dangerous to their skin and to their health. So I so much agree with the comments that I'm seeing in the chats.
It's interesting looking at the poll in terms of where people are buying these products from. And I'm thinking about the comments that Michael made about online, and that there's a lot of online sales and targeting online sales. Whereas, you were showing in Lesotho, and how the poll now is showing that quite a lot of people are buying from street vendors and local markets. I wonder if the people who are selling on the street vendors and the local markets, so if there's a middle person who's actually buying them online, do you know where people are actually getting the products from in Ntseke, in Lesotho, that are being then sold?
I will say specifically for those that are selling in the street vendors. From our study, where we conducted our study, it is the near border is KwaZulu-Natal. So most of the street skin lightening products are being imported from KwaZulu-Natal. As for the online, I'm not sure, but I haven't seen anyone. Maybe it's because in our country, buying online specifically for people in the rural areas is not so common. But I believe maybe if our study will also focus, maybe wider, also focusing people who are working class, also people, women in the cities, then maybe we'll be able to get further information whether they are also importing or buying them online.
And just for the audience, if you're not familiar with KwaZulu-Natal, that's South Africa. So Lesotho is bordering on South Africa. Michael, did you want to come in on that?
Yeah, and very interesting poll as well, with so many purchases that are indicated that not to be online. Although I would point out that one of the avenues, at least in the U.S., is that local markets, different vendors purchase the products online. So they can come in through other means, but in I'm guessing that in many countries where in the EU, in the US, and other places that have pretty vigilant border inspections, that meant most of this is getting through online. That's one of the challenges that I mentioned earlier, that governments really have a hard time figuring out how to deal with online commerce and the regulations around that. So it would be interesting if someone could do some kind of a survey or a study to determine, how much is coming in across the border versus how much is coming in through online vendors. Because that's really interesting. The street vendors, the cosmetic shops, the local markets, what percentage of that, do you want to take the time and effort to go across the border, or get someone to go across the border, bring a product in, or do you just want to order it online? It takes maybe 5 or 10 minutes to order it online, and it gets delivered in 2 or 3 or 5 days. Thank you.
Thanks for that, Michael, and thanks, Natasha, for going back to that poll. If you could go back to now the next poll that we've been working on. So are mercury-containing skin lightening products allowed in your country? Interesting, 4 have said yes, that they are allowed. It would be, if you could put which countries that is in the chat, would be most useful. Are there any last questions for Ntseke? We are slowly coming to an end, not quite yet, but heading that way. And Ntseke, are there any other comments that you would like to respond to that are in the chat? I see we have another poll, which is there legislation restricting mercury added products in your country? Sorry, Ntseke, back to you.
Yes, I also agree the last comment that just popping that the skin lightening products are also found in the small supermarkets in the country.
And
because
thanks to
all of the skin lightening products that men use, they are all imported because we don't have any manufacturers of skin lightening products in our country.
Thanks. Sorry, I didn't mean to interrupt. I was going to say thank you to Henry, who has indicated that the products are allowed in Liberia. So thank you very much for posting that. Would be interesting to see what the other 3 countries were. We have our last poll on the screen. If you click on the Mentimeter link in the chat, you're welcome to indicate if there's any legislation in your country, specifically in relation to skin lightening products. As we discussed earlier, although this discussion has been about mercury, there are other hazardous chemicals within these products. There was, Isaku, you've made a comment about whether we could send the chat to the Minamata Convention, and you have given us your email address. Thank you for that. We appreciate that, and we will do that. Also, just to let everyone know who has participated today that we will be producing a digest. So make sure that you have signed up for this community of practice and join the WhatsApp group if you like. There will be a digest summary of the discussion and a summary of the chat and the polls. There is also, you can go back to watch this discussion if you like. Natasha will put the link in the chat, and you're welcome also to go back and see other discussions that we have. There are recordings and digests. We also have a newsletter, and the feature of the newsletter this time around was on skin lightening products and mercury containing. So please do go to the link and have a look for those as well. Ntseke, is there any last comment? We've got 1 minute left before I conclude. Was there any last comment?
Okay, Prof. All I wanted to conclude the discussion is that as Lesotho, like I mentioned, we are part of the Minamata Convention. It's close to 10 years now, and there's a progress in terms of restricting some of the products that have mercury. I'm saying that because it's last year when we had a strategy to phase out some of those mercury added products. What is left is just for the country to have legislation that will really stop importation and using of those mercury added products in our country. And thank you so much for the discussion, and thank you for being part of that.
Thank you, Ntseke, and thanks for those last comments. And again, thank you for sharing your MPH study with us. I'd like to also thank Elena and Michael again from Zero Mercury for taking their time and providing a lot of useful information, both during your presentations, but also in the chat. So thank you for that. Just a reminder again to sign up for the Chemicals Network discussion if you haven't already, and that the next discussion will be on chemical risk communication, which is on the 18th of July. And as you can see from this discussion, how important risk communication is, with Ntseke saying that 30% were unaware of the hazards. Also, don't know if we have a slide, but just to remind you that UCT has a master's in chemicals risk management, which is fully online, and we encourage you to sign up for that. You can also see on the screen the link to the master's that Ntseke did. So thank you very much. Thank you to the presenters. Thank you to the participants. And we'll see you on the 18th of July. Go well.